Researchers are calling for better prevention and treatment of psychiatric illnesses among autistic people. The call comes along with a new study of Ontario health records, which show that autistic females had an 83% higher risk of self-harm than non-autistic females. Now, autistic males had a 47% higher risk of self-harm than non-autistic males. Lead author Dr. Meng-Chaun is a psychiatrist at the Center for Addiction and Mental Health, and he says that psychiatric disorders play a big role in explaining the increased risk of self-harm. Dr. Lai says the findings support previous research showing that autistic people are more vulnerable to anxiety, depression, ADHD, substance use, and some psychotic disorders. Well, joining us now is Dr. Meng-Chaun himself. Sir, welcome to Forum Daily.
Thank you for having me.
So what does these concerning study results mean for the diagnosis and treatment of those with autism, sir?
Absolutely. So what we found was that autistic people are more vulnerable to experiencing self-harm events and also in the rare cases, suicidal death. And we also note that many of these associations are related to the psychiatric illnesses that they may be experiencing. So what we learned is that after you account for these effects of psychiatric illnesses, the risk of these self-harm and suicide events has substantially gone down, meaning that the psychiatric illnesses play a significant role in contributing to the heightened risks for self-harm and suicide.
Now, it's really interesting that, as you say, the study supports previous research indicating that autistic people are more vulnerable to almost all kinds of psychiatric disorders. However, these psychotic disorders are often going undiagnosed among autistic people. So why is that the case, Dr. Lai?
Yeah, this is a great point. Many autistic people may present with psychiatric illnesses, including the severe forms such as psychotic disorders. And some of these symptoms may not be well recognized because some people may consider the presentation are just part of autism if they just look different from other people who are not autistic. Some of the symptoms may not be communicated well from autistic people. And if you don't know the person well, then you may be missing the signs of the changes of their mental health presentation. On the other hand, there could be the opposite response, which is autistic people's autistic features could be misrecognized or misdiagnosed as psychotic, which can also pose some additional problems, including unnecessary medication use and other treatment as well. So this is like a double-sided sword that we need to be aware of the baseline of the autistic person and then to appropriately recognize the mental health presentations of that.
A double-sided sword indeed, sir. Now, you say that this is associated with diagnostic overshadowing. So what kind of steps do you think need to be taken to prevent this diagnostic overshadowing in our system?
So the first thing is that we need to know the unique features of communication and thinking styles and expression of autistic people to start with. Then we need to know the baseline of the autistic person. Then, because what we understand about psychiatric illnesses is that they often come as something additional to the person's presentation. So for example, depressive symptoms, anxieties, or even psychotic symptoms, hallucinations, and so on. These are different substantially from the baseline of the autistic person, then we have a better chance of understanding that. And also it is important to hear how autistic people and their families explain their experiences of mental health. So mental health providers can have a better understanding of the real experiences of these symptoms, because they may actually be experienced or expressed somewhat differently from people who are not on the spectrum.
And in addition to diagnosing patients being an issue, there seems to be a gap when it comes to the treatment of autistic patients in terms of psychological issues. So can you tell us a little bit more about what needs to be done about that?
Absolutely. So what we know is that mental health issues can really be supported and at the best, early on. So, at the very early stages of distress, we need support. We need access to support. And the lack of access or insufficient access to mental health support is not unique to autistic people. It's actually across the board. But it is particularly difficult for autistic people because, first of all, some providers or care systems may not be well equipped to deal with so-called more complex presentations. So some autistic people may even find it hard to find provider that can help them to cope with mental health issues. And secondly, the presentations of mental health issues could be more complex. So it is important that providers are equipped and being supported to learn about how autistic people experience and present mental health issues for their challenges to be well recognized. there are some very important tips that people have provided. So there's a model called the SPACE model, which is presented by some autistic doctors in the UK and across the globe. And they suggested there are 5 key points that mental health providers should be, and health providers in general, should be aware of the unique features of autism. So first, S stands for sensory sensitivity, sensory features. So we need to be aware of autistic people's sensory needs. P stands for predictability. So it is important to understand that autistic people actually need predictable routines and environments. A stands for acceptability. So accepting autism as is so important. C stands for communication, understanding autistic people's need for specific, accurate information. So not to give vague and information or question that's metaphoric, because that's too difficult for autistic people. And then finally, E is it stands for empathy. So understanding that there's a misconception of autistic people lacking empathy. It's very important for us to understand actually many of the situations are basically a breakdown of communication in between. So autistic people may have difficulty communicating, but non-autistic people may also have difficulty understanding autistic people. So building the bridge for mutual understanding will be the foundation to provide what we call autism-informed accommodation to care.
All right, Dr. Lai, a very helpful acronym. Thank you again for joining us today on Forum Daily.
Thank you.